Morning, mamas. So good to see you. I wanted to hop on today and address a couple questions that some of the moms have that had C-sections. So maybe you're a mom that recently had a baby. Maybe it's been a while, but you still feel like your abs just are not letting you do what you want to do. Totally get it. Super common. So a couple things to address first. Sorry. For one, let me know if you catch this live. With the software I'm using today, I can't see if you're actually on live with me. So hey, so good to see you guys. And if you come on by and happen to catch the replay, let me know you stopped in. Say hi in the comments. I love seeing who's able to make it in and spend some time together. So what I want to talk today about is the C-section. So for one, if you are newer out, you need to make sure that your incision has healed. You can start with what's called scar massage. So what you're going to do is, and I'm going here because that's where my mom's C-section scars. Move some stuff out of my way. I know most of it is still kind of lower bikini lines where they try to make it. If you had an emergency C-section, depending on how much of an emergency it was, you may have a central scar down the center. I know, for example, when my mom had me, it was a quick dash to the emergency room, or to like the operating room, and they just sliced straight down the center, and they even cut like a little bit of my eye because they were that urgent on trying to get the delivery. So depending on your scar location, I'm gonna say it's here just for the fact that you can see here, and you can't really see here on me, so I can show you what to do. You want to go along the scar, and you're going to rub in circles around it. And then you can go cross friction, so you're going to go back and forth. If the scar would be this way, you're going to go opposite. Apply just a light pressure. As it gets less sensitive to touch, you can start to apply more pressure as you go. That's very common scar massage. You can also minimize the look of your scar if you use some vitamin E oil. This can be found at like Kroger, Walgreens, places like that. Walgreens, I know, like Rite Aid, those type of stores. Sometimes it's easier to find just because they have like all of that kind of lotion and cream and medical stuff kind of condensed together in a little bit better way to sort through and find things. So if you're searching, check that. If you need to minimize scar. And then know that no matter what, whenever you're picking up baby or you're holding a gallon of milk or the things that are heavier, right now your abs aren't able to basically contract and hold that extra weight. And this happens even for moms that don't have incisions, but if you have an incision, they still cut through some of the abdominal muscle. So in talking with a friend who's a OR nurse she's an OB nurse, but has been in for a million C-sections. Her and I were speaking one day, and she was telling me when I was asking further questions, sometimes they stitch the abs back together of where the muscle is that they pull apart, and sometimes they don't. But regardless, you still had a disruption to your fascia. So fascia this is kind of a gross thing to think about, but it's the best way to visually know. So you know if you have like a piece of chicken and under the skin, there's still kind of that like clear, filmy, like real thin. That's basically like a fascia. And we have that grouping our muscles around little sets of muscles, and it's all of our entire body. It's a thin connective tissue. And this fascia can get restrictions in it. And it's sometimes what we feel like that tightness and that tension that we just can't get to seem to go away. Same thing sometimes with our neck. But anyway, if you can get that moving, sometimes things just slide and glide on each other better, and it feels so much better. So there's a few things for myofascial release that you can do. One, just simply massaging not just the scar, but also across all of your abs. So for myself, I'll be honest, my youngest is 2. I've still been treating myself because kind of right through here, So he was my biggest baby out of 3. And I didn't do anything at first, even though it was sore. And then I was like, okay, I've been ignoring this for way too long. I need to actually address this. So I've been working through it myself and healing myself on some things I was just like, I don't need to do that this time around, right? If that's ever you, let me know in the comments if it's like, that's me. That you just kind of push it to the side because you're busy. Like, you have kids, you have to feed the little one, and like, excuse me for my cough today, allergy season. It just doesn't really happen as much. So when you do get the time, it's like, oh, hey, I need to kind of like address this whole area, right? So just doing some basic massage techniques. So coming across like this and coming in patterns both directions can be helpful. Now, one thing that I have found that works really, really well for myofascial release, this is, I don't know if I'm saying this correctly, a Corgius ball. You can find them even on Amazon. Honestly, it's kind of like the bar 3, like bar type of balls. So it's a little squishy. They sent, it was really weird, quick side note. So they sent like a little straw, like a drinking straw, to put in the hole to like blow it up. Wasn't very effective. It was kind of deflated. This is like a lot more blown up than what it was. But you could take, if you have toddlers, if you have other kids, you can take a kickball, something similar. It doesn't have to be this. This was like $17, $18. So you don't have to spend that. I got it because I could also use this for work. So for me, investment-wise, made sense. For you, if you have kickballs, other things around that, just find that in the house. If it's a little bit on the deflated side, is actually better because you want it to be a little bit squishy. Then you can do this one of 2 ways. You can do this either standing, and you're gonna put pressure on the ball, and you're gonna take it across your abs. And honestly, if you get contact to skin, it's going to feel better. I'm vulnerable here, guys. Mommy tummy, right? Which looks better on video than it does in person. Anyway, you're gonna put your hand here, and you're just gonna take it and massage and give pressure. To myself, because I have a few areas of fascia that just don't feel good still. And when I do core work, it bothers me. And that's why I was like, okay, I need to start addressing this. But you basically can just rub up and down, giving that pressure. If you're a new mom, as far as like newly C-section, you're still healing and going through that process, this pressure might be all you need, okay? You're just gonna kind of work up and down. So up and down is within the fibers of the muscle. And then if you go side to side, you can use both hands to give more pressure if you want. Side to side is going to give you that cross friction of the massage, okay? If that doesn't really feel like it's like, I don't feel like I'm doing anything. What am I doing? Am I wasting my time? What you want to do then is you can actually lay on the ball, and you can either find like a trigger point with your body weight, and you can kind of plank up a little if you feel like your full body weight is just too much on it. But if that's okay, you can even kind of roll and like basically think if you're like in a plank position on your elbows and you're kind of rolling back and forth on the ball. That's very effective as well. And then if you want, you can either just be rolling back and forth on the ball, or you can hold when you feel like a tender spot for kind of that trigger point, and hold for about 90 seconds and let that resolve. That's gonna help you a lot more on this healing process, because part of it is getting the myofascial releasing and feeling good and moving. Part of it's getting the abs strengthening, and I'll do a second video on a little bit of the ab stuff for you so that this isn't too long. And then the third part is getting it to activate and contract when you're doing functional movements like lifting baby, lifting the jug of milk, carrying in groceries, lifting a laundry basket. All of those things that you do day to day in life that all of a sudden it kind of hurts, and figuring out where to start with exercise. I'll do some other videos on that as well, but we're gonna leave it with that. today, and then I will fill you in on a few other things. Let me know in the comments if this was helpful. And then let me know too if you have lingering questions, if I missed something that was on your minds that maybe I didn't address, and I would love to help you out and dive in a little bit deeper. If you want me to type up a quick guide for this as well, type in like C-section guide, and it'll take me a couple days to get everything together, but I'll compile like a little guide for you as well. Okay? Have a great day. Enjoy your time and enjoy your little ones. Have a good one, guys. See ya.